And now we are joined by another very important speaker for the inaugural session. We're joined by Sunil Kumar Bhushan, Deputy Director General and Head of Health Sector, NIC, Government of India. We welcome Sri Sunil Bhushanji. Thank you so much for joining us today. We'd like to hear from you your vision on digital strategies for transforming public health in India, technology, governance, and service delivery. Before I hand over the session to Mr. Bhushan, let me also inform our viewers, our audience, that to eminent guest of honor for this conclave, that is Sri T.S. Singh, the Honorable Minister of Health and Family Welfare, Government of Chhattisgarh, and Dr. Dhan Singh Rawat, Honorable Minister of Higher Education and Medical Health and Family, Government of Uttarakhand, will also be joining us today in the later half of the day. With this, over to you, Mr. Sunil Kumar Bhushan. Always a pleasure getting insights from you on the use of technology, especially giving the NIC perspective. Over to you, sir.
Thank you, Shawik. First of all, I would like to thank APAC for inviting me to this health tech innovation conclave. So I was thinking, how do I go about it? So in last 2 years, we have faced a lot of challenges also, and we solved most of them, especially in the health sector. And that has been experienced by NIC and other health institutions during the COVID times. So I tried to summarize the 5 learnings by giving the examples, so which I experienced during last 2 years. So 5 learnings are as follows. And let me explain each one of them by giving some examples. So first learning is basically develop independent system, but focus on integration by design. So we have been developing a lot of independent systems, but their integration, we mostly do the integration by force, not by choice, not by design. So we learned that while developing the independent system, we should focus on integration by design. And the second learning which has come up, that we have to make our software intelligent. Now normal software cannot work. So the users do not accept the normal software. They want their software to be more and more intelligent. And the third learning is you have to analyze the data. So data collection is not the objective, only reporting is not the objective, only dashboard is not the objective. You have to analyze the data so that we can make use of data for various purposes. That is the third learning. And the fourth learning is that you cannot keep medical devices in isolation. You have to integrate the medical devices with the applications, with the software. And the fifth and the last one is basically you have to make your digital infrastructure scalable. That is the most important learning we have experienced during the last 2 years. So these, let me go a little deep into each one of the learnings which we have learned during the last 1 or 2 years. First one is basically develop the independent system, but focus on integration by design. So let me give one example. We have a CGHS system. NIC has developed CGHS system for OPD in wellness centers. So CGHS dispensaries, and PMJ empaneled hospital is giving services to the CGHS beneficiaries. They are IPD services. Now both the systems have been integrated. So although it was a integration by force, but one of the learning was that we should have developed this system integration by choice and by design. Although we faced a lot of challenges in that, but as on today, the system of integrating both the system CGHS and PMJ empaneled hospital. OPD and IPD both are integrated with each other. And second example is we have e-hospital software, which is HMIS, Hospital Management Information System. And another on the other side, some vendor has developed Mera Aspatal for getting the feedback on the services. So on one part, you provide services to the patients through e-hospital, and through Mera Aspatal, you take the feedback services given through e-hospital. Both the systems are integrated. Once you provide any service through e-hospital, the data is integrated with the Mera Aspatal, and the feedback is taken from the beneficiaries, from the patient through Mera Aspatal. So both the systems are integrated. So and the third example is we have e-hospital, and on the other hand, there is a National Digital Health Mission. They have developed Health ID for 6 UTs, and integration of e-hospital with Health ID of NDHM is already there. It means patient can come, they can get registered, they can through basically Health ID, and they can also take the services based on the Health ID issued to them by NDHM. Another is there is a Arogya Setu app, which is contact tracing app. There is a COVID-19 app, and both of them have been integrated for the purpose of data sharing, so that contact tracing collected through Arogya Setu is available to the states for taking the action at the on the ground. So integration has happened. So there is a ICMR lab app. There is a RT-PCR app for sample collection. There is a COVID-19 S3 app. All the 3 apps has data in common. So it means they are sharing the data. They are not collecting the same data again. So based on these 5 experiences, I can definitely say that future application we should develop where we should design the application keeping integration in view. So we have to find out what is not only the system, you have to understand the ecosystem. What are the basically stakeholders outside your system who can use your data? So that is the first learning. And the second learning is making application software intelligent. So one of the example I can share with you is basically in CGHS, we used to display the list of medicines while prescribing, while doctors are writing the prescription. So now we have shown them that we show them only those medicines which are available in the store. So making the list and making the list which is available is making the software little intelligent. And we are sending email, we are sending SMSs to the beneficiaries based on the condition, health condition of the patient. So once they are captured in CGHS, either they are captured in reproductive and child health RCS system. So auto reply based on the condition applied. So that has made these systems little intelligent. So I think all of us know that FAQs are being the part of every website. So now those the time has come. Then these FAQs are going out, and we are in the process of developing and implementing chatbots and voice bots, so that people can easily, intelligently talk to computer and get their issues resolved, at least simple ones, for which they need not to contact any basically concerned person in the department or in the office. Another thing is earlier we used to capture only mobile number, we used to capture Aadhaar, we used to capture PMJ ID, we used to capture this driving license. Now we are just not only capturing, we are authenticating them. So it improves the quality of data and make the system more intelligent, and user basically the data will be more used because it is authenticated in nature. And apart from this, we have applied AI, artificial intelligence, for detection of the disease, especially in case of COVID-19 and TB. Chest X-rays, we have developed certain models where a lot of data has been collected from the government hospitals, and they have been submitted to the model. And out of that learning, when we submit one X-ray, it tells something whether the TB is there, whether the COVID is there or not. So such kind of models have come up to bring the intelligence into the software. So these small applications are making our health applications intelligent, so that people can use them effectively. And the third is basically we should analyze the data to make best use of it. So example for this is we have in RCS system, we have 21 crore eligible couples with 20 crore pregnant women and 17 crore children immunization record and the pregnancy record and their services provided to the pregnant women. And we have 21 crore transactions in e-hospital, and we have an OPD record of 39 lakh CGHS beneficiaries. So all this data is available with us. Now we are applying data science principles on these databases so that we can work out the model so that services can be made to the patient in an effective manner. And we are using other applications to use this data so that they can also bring intelligence into their system. So this is about analyzing the data. And we have tried integration of medical devices with our health applications. And one of the latest thing is, as you know, most of the basically health facilities, they are being provided with PSA oxygen plants with a capacity of 900 or 500 or 1000 LPM capacity. So they need to be monitored, and the IoT devices are being fixed into the PSA plants, and those data from PSA plant is coming to cloud, NIC cloud, and they are being shown in the especially pressure, flow, and purity that you can monitor on the dashboard. And while sitting at wherever you are, you keep monitoring about your PSA plant. So this way we have for first time experienced the use of IoT in monitoring of PSA oxygen plants. We have been we have already integrated lab analyzers so that the result of a particular patient, it is passed on to the health applications automatically rather than entering into the application. So that integration with the lab analyzers have been experimented, and about more than 200 lab analyzers are already integrated. Similarly, we have integrated with PACS, that is for radiological devices, X-rays and ultrasound, etc. So their data is also coming to PACS, and we have a product called Collab DDS. So where you can integrate your radiological data into the Collab DDS for effective use by the doctors. And we are in the process of that devices. Especially we are using say BP devices. We are using diabetic devices or heart devices. We are also in the process of integrating with the personal wearable devices. And then we are also integrating with the ICU devices. And the last one is basically we are making my recommendation is that all the health applications, they should be their digital infrastructure at the back end should be basically scalable, and we should make our applications based on microservices. Container-based cloud environment should be used, and we have started migrating to these technologies so that we can make our applications scalable. And we should have DR in place, and we should apply technologies like caching, queuing for to bring the scalability in our digital infrastructure. And auto scaling of the infrastructure should be ensured. So let me sum up these five principles again to conclude the session, that we should focus on integration by design while developing the applications, make the application more and more intelligent using AI, ML techniques, and we should apply data science for analyzing the data for using for in research and other purposes, and we should integrate with the medical devices. And the last one is we should make our digital infrastructure scalable, application scalable. Thank you very much. Again, I thank Shovik and APAC for giving me this opportunity. Thank you very much.
Thank you so much. Thank you so much, Sri Sunil Kumar Bhushan, Deputy Director General and Head, Health Sector, National Informatics Center, Government of India. As usual, Mr. Sunil Kumar Bhushan has been very targeted with his approach while he was giving the kind of work being done by NIC during the pandemic and what is the future, especially if I take a crux of what you have said, that you have given example of CGS integration and also how e-hospital with the NDNHM database has been integrated for 5 or 6 UTs. I think if I take a crux of what you have said, that we have to now, from now onwards, we have to keep in mind that design any application by keeping in mind the integration part of that, and also making applications making some application software intelligent, so that a lot of integration can be done in the future for the overall healthcare infrastructure, especially when it comes to technology and innovation. Thank you so much, Mr. Sunil Kumar Bhushan, for joining us in the inaugural of second edition of HealthTech Innovation Conclave. The tagline of this event is Decoding the Future of Healthcare Technology. Until now, all the speakers who have been part of the inaugural session have actually tried to give their perspective on how we can decode the future of healthcare technology, especially keeping in mind the realities of India and the new world order. Thank you so much.